The Honourable Leader of the Third Party.
Thank you so much, Mr. Speaker. This government has talked enthusiastically about promoting rural development on PEI, and last year they even created a new Ministry of Rural and Regional Development specifically to support this goal. Last evening in Krakow, well over 100 people gathered to discuss the imminent loss of their doctor. For rural areas such as the South Shore, maintenance of critical services such as schools, recreational facilities, restaurants, retail outlets, and local access to medical care are crucial to a community's well-being. A question to the Minister of Health and Wellness. What will his department do to support the South Shore area in maintaining the pillar of this region's prosperity, which is local access to health care?
The Honourable Minister of Health and Wellness.
Thought I was getting a break there for a second. Anyway, Mr. Speaker, it's a very good question, and I had the opportunity to meet with the Honourable Member and the Honourable MLA for Borden Kincora area, as well as councillors just the other day, and we discussed the issues and challenges that are faced by the community of Krakow. We've provided them with numerous options that may be possible to help alleviate the situation there. It's really about the community coming together and approaching different healthcare providers out there to see what possible business arrangements could be made, Mr. Speaker.
Minister. The Honourable Leader of the Third Party, your first supplementary.
Thank you, Mr. Speaker. Indeed, the community did come together last evening, Minister, and one of the things that was talked about was setting up a task force to proactively go and look for a doctor themselves. So, question to the Minister, if the community is indeed successful in locating and recruiting a suitably qualified and accredited physician, will his department consider issuing a new billing number for the area?
Honourable Minister of Health and Wellness.
Mr. Speaker, as when we had that discussion the other day, we talked about those options, and there is a process that we have to go through when we're talking about adding new members to the complement or new billing numbers, and there's a clear process to doing that. So if there is a physician that's where they want to particularly practice, and there happens to be no vacancies in the billing number in that particular area, we would certainly work with that community to try to go through that process to help add another billing number. We also discussed a lot about the concept of a nurse practitioner working with another physician in another part of the island under a fee-for-service model that may work very well too, Mr. Speaker. So there's certainly lots of options, and we're certainly willing to commit and work with that community or any other community when it comes to providing primary care to their needs, meet their needs, Mr. Speaker.
Minister. The Honourable Leader of the Third Party, your second supplementary question.
Thanks so much, Mr. Speaker. The way that primary care delivery, healthcare is being delivered is undergoing profound changes, as I mentioned in my member statement at the beginning. The more collaborative approach, known as primary healthcare, is about creating the conditions that help people to become and stay healthy and well. This model involves more extensive use of nurse practitioners, pharmacists, physiotherapists, and other complementary providers. Health practitioners in the South Shore region developed an innovative proposal that was based on this model a couple of years ago, but government would not support it. Will the Minister reconsider his government's position and work with the local community on this innovative development that would ensure access to rural primary health services?
Honourable Minister of Health and Wellness.
It's a good question, Mr. Speaker, when it comes to the issues around nurse practitioners, especially many nurse practitioners are in here. We have seen our complement of nurse practitioners increase, Mr. Speaker, in this province. I think there are approximately 20 nurse practitioners practicing all over the island. We continue to look at possible models and opportunities for nurse practitioners but we also have to work with the medical society in that, Mr. Speaker. We have to make sure that we're providing them the right services and supports and when they're working to provide primary care to islanders, Mr. Speaker. And like I said before, whether it's Krakow or any other community, if a nurse practitioner model could work, we certainly would look at that. And we've seen cases, I think, even in Cornwall, where we've teamed up a nurse practitioner with a doctor to, once again, meet the panel sizes that the previous position would have carried.
Thank you, Minister.